Welcome back to News 2 at 10. Children, they are being put at the forefront as law enforcement continues to find drugs inside homes where kids under 18 are present.
But what happens when their parent or guardian is locked up? News 2's Mai Owens found an alarming trend one organization is trying to tackle in rural communities.
We're usually kind of behind the trends, but when it hits us hard.
Hard drugs like heroin and fentanyl making their way into homes, creating a devastating impact on children. Trent Coffey, director of the nonprofit Stand, says with every case there's a consequence, especially in rural communities.
We're dealing with the worst of the worst, after consequence, if you would say, like after they get charged.
Over the past 3 years, the number of children connected to a drug allegation was the highest in 2019, with more than 43,000 claims in the state. But what happens to the kids once their parent is arrested?
When a parent or somebody gets a charge or there's an allegation or something like that, the state, with the resources they have, are good at bringing in the Department of Children's Services in and then looking to see if that child is safe, seeing if they need to do alternate placement.
Coffey says it's all about early detection, training staff to look for signs of trouble in the home. But once an allegation turns into an arrest, another process starts. For example, if drugs are found in a home or in a car and a child is present, the organization is able to step in and notify the child's school, giving them a warning to look out for any behavioral issues.
If there's something that comes up, we know that we may have to give a little grace and maybe know that there's a situation that's happening that we may just need to address, and maybe take that child to the side and give them some extra care.
Organizations like STAN work with law enforcement to make a treatment plan. Already this year, more than 12,000 allegations have been made statewide. But Coffey says that number could rise once children go back to in-person learning in the fall.
We can see the deterioration of an attitude or nutrition or something like that, even seeing physical marks or bruises or something like that. We lost that day-to-day connection. Whenever we come back, I think there will be a plethora of things that pop up because it was unidentified before.
He says oftentimes drug-endangered children suffer mentally and physically, and that's why intervention needs to happen and happen fast. Mai Owens, News 2.
Now, he says the organization depends on those around the children to catch the warning signs because oftentimes government systems are too overwhelmed to catch every case. If you suspect a child is drug endangered, you can contact 1-877-866-6384 to report it to state officials.